Today in series of Docplexus KOL interviews, we have with us Dr. Michael Alvarsson. He's a professor at the Karolinska University working at the Clinic of Endocrinology, Metabolism and Diabetes. He also conducts clinical studies research at the Department of Molecular Medicine and Surgery. He is widely known for his clinical studies on B-cell rest and hypothalamo-pituitary adrenal axis on metabolic control in diabetes, and clinical studies on the effect of training on patients with type 2 diabetes. Some of his recent publications include effect of high dose of vitamin D on beta cell function, gender differences in type 2 diabetes course and outcomes, and the ACTS sensitivity in diabetes. Thank you so much for the interview. So let's begin with the first question. So doctor, what are your thoughts on the treatment of impaired renal function and glucose lowering agents in diabetes?
Well, my first talk today on this congress is that I will talk about how to lower glucose with the new agents in patients with impaired kidney functions. I've been the lead investigation conductor in several studies for the cardiovascular outcome trials in Sweden, SAVOR, the TECOS, and also the upcoming DECLARE studies. And some knowledge from those studies and some of the new cardiovascular outcome trials has shown that these new drugs that have beneficial impacts on cardiovascular outcomes also have beneficial impacts on the renal outcomes. And that, I think, is very interesting to put forward into these talks.
Okay, so moving on to the next question. So can you shed some light on cardiovascular outcome studies that have been investigated by you in Sweden?
Well, these studies have mostly been published, for example, SAVOR and TECOS. They're very known that they are neutral, these drugs. They are no harm to have them treated these patients. We don't know really how the upcoming DECLARE studies, what they will show, but DECLARE is using an SGLT2 inhibitor, and probably, or hopefully, we'll see that they will also be beneficial in conclusion with the other two studies that have been done in that field, IMPAREG and the CANVAS program study.
Okay. So moving on to the next one. There's high prevalence of PCOS in type 1 diabetes patients. So are they linked, and what is the treatment?
Well, I'm glad that you asked that question, because that is my main research focus just now, because there are some indication that polycystic ovary syndrome is more prevalent in type 1 diabetes patients. And we know that type 1 patients, women with type 1 diabetes, have less fertility and higher risk of miscarriage. And we also know that polycystic ovary syndrome has the same problem with less fertility and a high risk of miscarriage. And if those two conditions is linked, are linked, perhaps we can come up with some solution to the problem for the type 1 women with less fertility and high risk of miscarriage. We know, for example, if you use insulin, you have to use high doses of insulin that causes higher level than is normal in the systemic circulation, and that can cause a release of LH, and that causes high levels of testosterone, and that can lead to polycystic ovary syndrome. So the solution may be to use, for example, pumps that decreases the insulin requirement with about 25%, or we can use, for example, metformin that is very cheap and lowers the insulin levels, and that could perhaps be good for the fertility in these women.
Okay. So doctor, lastly, I would like to know your thoughts on the high burdens of diabetes in India.
Well, I think you really have a challenge here, because to have more than 100 million patients with diabetes is quite a challenge. And I think one thing is that you have to stop this explosion of diabetes, of course. I think that needs a more healthy lifestyle, perhaps. How can you manage that? And also, you have to have treatment that is efficient and also quite cheap if you have to treat all these patients. But in the end, you have to treat them, because in the other end, if you have all the complications to care, it's an enormous burden. I mean, both in the personal burden and also socioeconomic burden.
Right. Thank you so much for the interview. It was a pleasure having you here.
Thank you very much.
Thank you.